Hi, I'm Dr. Hagmeyer, and I'm the clinic director here at drhagmeyer.com, where we help people from all over the world find answers and solutions to the problems that they're suffering with. Hopefully, you've already watched my first video explaining really why most people with chronic health problems never get better and really what makes my office different. The reason I put this second video together is that I realized that the process of becoming a patient and working with us is just very different than what you're probably already familiar with. So in this short video, you're going to learn more about my case review and why you should consider it if you're serious about getting to the root cause of your health issues. And if you stay with me to the very end, I'll help you understand how to expedite and speed up the process of getting an appointment so that we can help you get better faster. Now, when it comes to the case review, whether you're doing a comprehensive case review because you have multiple health problems and you have a complex case, or you're doing the low complexity case review, this is really the starting point for every prospective patient. We offer many different services, but in this case, the case review is what helps distinguish you as a patient. If you purchase a comprehensive case review or the signature program, there are 7 parts of your new patient application that we review prior to your appointment. So it's very, very comprehensive. The case review, this is where it all starts. This is the information that I gather that allows me to begin and start looking at the context of all the concerns that you have and all the symptoms that you have and how that's tied into various problems that testing will ultimately help us isolate and figure out. The case review helps us understand your big picture. You see, a good treatment plan is only good as the testing that's been run that has identified where the problems are really stemming from. And I hope that makes sense, right? You can't fix something if you don't know what caused it in the first place. And that's why this case review is so important and why I take it as seriously as I do. And I spend the hour or 2 hours or 3 hours reviewing each patient's file. And so the purpose of that is really just making sense of it all. So let me review with you the different parts of your new patient application. Like I mentioned, there are 7 parts to this application process. We have the health narrative, we have a 7-day food journal, we have a metabolic assessment form, we have the neurological assessment form, there's a section for current and past medications as well as supplements. There's a section called the current health history form, and finally, there's a review of past medical and laboratory testing. This makes up the application. So let's start with the first part, which is the health narrative, right? The health narrative is a 3 to 5 page typed up health history that really gives you the chance to tell me everything and anything you want me to know about your case. This can be some of the deepest, most troublesome secrets that can sometimes just be difficult to emotionally verbalize or share face-to-face with a doctor. Or they may be things that you've tried unsuccessfully or things that you feel are contributing factors to why you're sick and why you're not getting better and making progress. What I find is that if you've ever felt rushed during your doctor's visit, which most people can relate to, or you just forgot to tell the doctor something that you felt was very important, the health narrative, this is the section that gives you that opportunity to share those things that often get forgotten or overlooked or rushed when you're sitting in an office waiting for your doctor. So essentially, this is where I get to hear from you, right? This is your chance to tell me everything you want me to know about your health or your loved one's case. This is where I get a chance to know more about you, who you are, what you're struggling with. And sometimes it's these things that provide the details that help us understand where you need help. Sometimes these are the things that are going on in a person's life that testing just doesn't show us, okay? The second part of this new patient paperwork and application is the 7-day food journal. This is really where I want you to share with me everything that went into your mouth for the past 7 days, right? The key that I try to tell people here is don't try to impress me. You're not being judged. Simply write down everything that you're eating, everything that you snacked on over the last 7 days. This is where I want to see what goes into your body, but also what doesn't go into your body, right? And so sometimes this can help us determine the kinds of testing that we may need to run. Maybe it's things like nutritional deficiencies that we have concerns over. Maybe there's food sensitivities. Maybe it's food allergies or food intolerances or what have you. But another thing I would say is don't change your diet during this time, because that will not be a good representation of what you eat. So in other words, don't start a new diet or start eliminating foods during this phase or during these 7 days. Don't start taking new vitamins. Try to keep your routine as consistent as it's been. The third and fourth section of this new patient paperwork includes a metabolic assessment form as well as a neurological assessment form. These assessment forms have various categories. The first one, the metabolic assessment form, has over 19 different categories with symptoms ranging from gut health to gut absorption to things like blood sugar handling, sex hormone imbalances, adrenal problems, liver function, mucosal tolerance, leaky gut, chemical sensitivity, thyroid problems, toxicity, etc. But each category has 7 or 10 different symptoms within that numbered category. Next to each symptom, you're going to see where it says 0, 1, 2, or 3. What you'll do is you'll circle 0, 1, 2, or 3 depending on how frequently or how severe the symptom you're experiencing is. The neurological assessment form follows the same format, but now it's designed to help us understand more of the mental, emotional, and neurological components that are often seen in conjunction with chronic health problems. These assessment forms are tools used to understand and gain a better understanding of how some of these symptoms are intertwined and interconnected, okay? The fifth section of the paperwork includes a section for you to list the medications that you're taking or the supplements that you're taking. Again, what side effects are you experiencing from them? What's helped? What hasn't helped? What's made you worse, okay? Every medication can cause nutritional deficiencies, and knowing what medications you're taking can help us, again, understand where we may need to focus some of our attention when it comes to testing. The sixth and seventh section components to this new patient paperwork in these sections include a review of your past medical history and a review of your past laboratory testing. If you've had past blood work done in the last 6 to 12 months, then I want to review that as well as see if anything was missed. The new patient application, hands down, is really just some of the most comprehensive paperwork that you will have ever filled out. I'll almost guarantee that you've never been to a doctor's office, or no doctor's actually ever spent the amount of time reviewing records or looking at your case the way that I've just explained. And to be honest, this case review takes a considerable amount of time. And for this reason, we have to limit the number of new patients into our program. This allows me to focus on, obviously, the most dedicated of patients. Let me say a few words about testing, all right? When it comes to testing, whether we look at blood testing or stool testing, saliva testing, urine testing, breath testing, genetic testing, these tests will all be tailored to your concerns as well as your health goals. I don't have a cookie cutter practice. In other words, I don't do the same thing with every patient who has a diagnosis of thyroid disease or Hashimoto's disease or depression or Crohn's disease or diabetes or really any other chronic health problem. And that's really why I do the case review. And let me give you an example. Let's say you experience chronic fatigue, right? This is a very, very common symptom that many, many people experience. And this fatigue really could be due to a number of things, right? In one person, it might be caused by a thyroid disorder. In another person, this fatigue might be caused by Lyme disease. In another person, it might be blood sugar dysregulation or blood sugar problems. In another person, it might be due to a heavy menstrual cycle where there's a lot of blood loss. The fatigue might be coming from a gut bacterial infection or a heavy metal toxicity or a mold exposure or nutritional imbalances like iron. So you see, chances are there are many different causes for the symptoms that you're experiencing. And only after I review your case can I then identify how I want to tackle your health problem, the kinds of tests that you need. This approach has really taken me over 20 years to develop, and it's what I call the big picture. And when you have a chronic health problem, each and every one of us has a unique big picture of why we're sick or why we continue to have flare-ups or why we're not getting any better. My job is to understand what your big picture is and how this is all tied and how it's all connected. The last thing I want to cover in today's video is what you need to do if you're really ready to get started, right? The process of getting started with case review is really very straightforward. It's very simple. In that it's the same for patients that are here in the United States or if you're an international patient. So the first step is purchase a case review. Whether you purchase a comprehensive case review, which is our signature program, or you purchase a low complexity case review, that's really the first step. Right? This case review can be seen on the service tab on my website. The second step is that once you purchased either the high complexity or the low complexity case review, you're going to be redirected to a page to download the new patient application. All right? It's very simple. Print up the paperwork, or I should say first download the paperwork, save it to your desktop, then print up the new patient application. Make sure that each page that requires a signature has been signed and that you've gone through the checklist included in that new patient packet. The third step is either mail your new patient paperwork back to the office, or if you have a scanner and you want to expedite the process, just scan the entire new patient application and then email it back to my office. Now, the one thing I want you to be aware of is that the new patient paperwork is processed in the order that it's received. Some patients want to expedite this appointment, and if that's you and you're looking to get an appointment sooner, I suggest you either overnight the paperwork, or again, if you have access to a scanner, scan it all into your computer and then email it to us. Once I've reviewed the new patient application, I've gone through all the paperwork, one of my new patient care coordinators will contact you through an email, and they'll provide you with several upcoming dates of availability for this case review. You simply pick the date and time that works best for you and really call in at the appropriate time. And that's really how simple it is. Now, one question that my team is often emailed when it comes to getting started that I want to address in today's video is, how much is testing going to cost me? And that's a fair question. Every patient has concerns over that, and we're sensitive to that. We understand that. So when it comes to cost, testing ultimately varies from person to person. The answer, or the true answer to that question, is I have no idea what testing is going to cost you, because much of this is going to be based on the complexity of your case and the kinds of tests that we need to run. The kinds of testing that's already perhaps that's been done, and of course how recent your tests are, and how in-depth do we need to get in order to understand your case and be able to get you the results that you're looking for. So I hope this video answers some of the questions that you have about getting started and gives you some insight into just how serious we take your health. Please be sure that you tune in to the next video that's titled Your Report of Findings and Treatment Plan. I'm Dr. Hagmeyer, and I look forward to providing you with answers, and I'll talk to you soon.